Well, aloha, good morning. Thank you so much for being here on this beautiful, is it Thursday? No, it's Wednesday.
Wednesday.
The days all blend together when you're in this stay-at-home order. So glad to have you join us this morning on the COVID-19 Care Conversation, brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. This is really a place where we bring experts and leaders to talk to you about the coronavirus and the response here in the islands. And Ryan, today we've got an excellent guest.
That's right. From Hawaii Pacific Health, we have Dr. Melinda Ashton, who's going to be talking a little bit more. Specifically, we want to get into the antibody testing. We're hearing a lot of discussion about that, about it being a possible way to test and sort of use to potentially see if visitors can arrive in Hawaii. And antibody testing is one of those test mechanisms that could help to decide if people should be allowed back in. We want to learn more about what the test provides and some of the issues that may be happening with it. We're hearing a lot of news about antibody testing. We hope to answer those questions today with Dr. Ashford, who's from Hawaii Pacific Health.
Yeah, and it's so important because we've heard testing is really, it's become a political issue. It's also just a buzzword when we talk about reopening the economy on all fronts. But we're going to talk about the difference between testing for the virus, doing the antibody testing, and what that could mean when it comes to our economy as well. Hawaii Pacific Health is really a leader in this effort here in the islands. They've announced that they're going to be testing or making tests available to all the workers at Hawaii Pacific Health, all the employees. So we want to talk about that effort and what those tests could reveal. We talk a lot about contact tracing too. We want to talk about how those two things intertwine. So we're excited to have Dr. Ashton with us this morning. She's going to be joining us in just a few minutes. Please type your questions for her about antibody testing and any other medical questions you may have when it comes to tracing the coronavirus here in the islands. First, of course, we always like to begin with the count and another day of single digits. Some good news there.
That's right. 2 weeks now of single digit cases. 4 new cases reported yesterday, bringing the total to 625 positive cases in Hawaii since COVID-19 began. Again, the death count has remained at 17. There were no new deaths reported. And so, as I said, a great sign that it was single digits for the past 17 days, so over 2 weeks. And the total number of recovered patients since the outbreak began is now up to 551. More than 88% of those who have been tested positive for the infection are now covered as classified. So those numbers continuing to do well. Another big headline happening yesterday, some confusion about the stay-at-home order becoming the safer-at-home order, but more importantly, when people are allowed and what businesses are allowed to reopen.
Right. The governor first announcing statewide lifting of a lot of restrictions, specifically on retail, looking at shopping centers reopening, among other things, and then seeing some what appeared to be pushback from the counties. So it looks like Maui and Oahu are going to wait an additional week. But May 7th was the target date for the state. Now it looks like it'll be May 15th for Oahu and Maui. So we have to. Basically, the governor is saying one thing and then the county's saying another. So the governor now saying check with your county for specific restriction lifting.
That's right. And there clearly was some sort of breakdown in communication there. And so we hope to get some answers. The order actually came out. The announcement was made earlier in the day, right after our broadcast, in fact. But the actual proclamation that was signed and sent out didn't come out till 2 hours before the 10 o'clock news. So a lot of people were kind of scrambling. We know that there were some discussions going back and forth between the counties. Actually, Oahu's May 15th. Maui has not announced the date as of yet. So they will be announcing that. So interesting to see how things unfold. We want to hear what you have to say about that. But more importantly, we want to kind of dive right into our topic that we wanted to talk about today with our expert from Hawaii Pacific Health. She has sort of been on the front lines in helping to lead the charge and helping to educate the public. We have Dr. Melinda Ashton joining us now live from Hawaii Pacific Health. Good morning, doctor. Can you hear us?
Good morning. Yes, I can hear you well.
Great.
Fantastic.
Well, so first of all, maybe if you want to talk a little bit about some of the efforts that Hawaii Pacific Health has been making and has had to undertake during this response to COVID-19.
Sure. Well, like all the other hospitals in the state and around the world, we have had to assess our ability to take care of a large number of very sick patients if that's in fact what was going to happen. And we all worried that it was going to happen when we first started with this late February, early March. We also had to assess and understand what was the correct personal protective equipment, PPE, so famous now, to make sure that we had the right protection for our employees so that they would be safe as they were caring for these patients. Because like everyone else, we watch the pictures on the news of people dying from this disease. And of course, healthcare workers who are caring for these patients are very nervous and understandably concerned to make sure that they've got the right protective equipment. So those were all of the early efforts that we put into place, and we've been successful with all of that. The interesting thing in Hawaii is with so few cases of COVID-19 requiring hospitalization, our hospital system has not been stressed by this. And in fact, we're more stressed really financially at this point because of not having any of our usual, or not much of our usual patient activity. So we're not now all in the business of trying to understand how to safely reopen while we keep an eye on what's going on with COVID disease in the community, so that we balance that. And we remain ready to care for patients, but on the other hand, we take care of those patients that have been waiting for us to reopen.
And a big part of that effort, of course, is the antibody testing. Can you tell our viewers the difference between a COVID-19 test and an antibody test?
Sure. So the COVID-19 test, the one that we've all seen pictures of everybody, with a swab up there in their nostril, that is a test that detects viral RNA. So particles or an intact virus will be tested in the laboratory. And when there is any virus activity, they may be live or dead, that test can be positive. It isn't 100% reliable in that it depends on how well you sample. It depends on what phase of the disease the patient is in. So early on, before they've got enough virus present, we might not find it. Or later on, if the virus has moved from the nose down the throat into the lungs, we may not find it. And so there are a number of issues with that test, although it's the best we've got. And the testing that we've done here has been very successful. We've done a lot of people throughout the community, and we've had a just under 2% positive rate, which is among the best in the country. So we're testing lots of people. We're not, we think, missing very many people who should be tested that aren't being tested. The antibody test is a blood test. And what we're looking for there is your body's reaction to having had the virus as either an infection with no symptoms, so asymptomatic infection, or an infection that might have landed you in the ICU on a ventilator. So all spectrum of infection can be detected several weeks after it occurs in your bloodstream. So it's the way your body fights off any infection. This blood test that we're talking about is specific for COVID-19 virus. And so what we're looking for in the blood test is, has your body had any experience with this virus in this, and usually it's 2 or 3 weeks prior. It can take a couple of weeks for the test to become positive. So we don't test it when we're worried about you being sick. It's not a good test to tell if you're sick because of COVID-19. It's a good test to tell if you've ever had experience with this virus in the past.
And if you've had that exposure, I think a lot of people then think if you test positive for that antibody test, then perhaps you're immune to the test, or to the virus. Is that the case?
Well, that would be the case for other infections. So we know that commonly that is true, and that's the way vaccines work. We stimulate antibody production, and that makes you then immune to that illness. The trouble is COVID-19 is so new, we just don't know. And so it's reasonable to think it might be protective, but it isn't yet known. And so we absolutely cannot and are not relying on the results to change any behavior at all. So as we decided to do this testing among our employees, we've been very clear and continue to be very clear that whether you get a positive reaction result, a negative result, or you don't test, we don't care. It doesn't change anything at work or in your behavior in private either.
There seems to be a lot of these tests that are hitting the market now, and some confusion. I mean, we've even seen local and state leaders as well as national leaders go back and forth about what tests to use. How do you decipher which one to use when there is now so many on the market, and how do you sort of gauge which one is the most accurate?
Yeah, this is a real problem. And because everybody wants to do it wants to get answers very quickly, and we're all wanting lots of answers. There have been a number of different companies, startups, entrepreneurs, you name it, some fly-by-nights that have put together testing. And we don't know the validity of many of those. There are studies that have been done that show that many of them are not valid at all, or are very weakly useful. We didn't go with any of those, although there were offers out there for us to go with a finger prick test of one kind or another. We didn't go with those. So we partner with Clinical Labs of Hawaii. They're our lab experts. And when they came to us and said, we've got a valid test, the FDA has given it the emergency use approval. And this is going to be a test that we do as we normally would in the laboratory on blood. We know how to do it. It's an instrument we already have. That's when we said, okay, now we're ready. So we believe we've got one of the tests that's much more reliable than many that are out there.
Okay, so how many tests have you been able to administer? How long will this program be going on?
We've told our employees that they can get their blood tested anytime in May. We've had some real interest, and so we actually have a two-part process. We ask that our employees fill in a little questionnaire. It's just a couple of questions that help answer, what's your experience been with COVID-19? Have you traveled? Have you been around someone who traveled? Have you been tested? Were you positive? Were you tested for the virus and you were negative? Those are a series of questions. And then there's another series that ask, have you cared for a patient with COVID-19? Or have you cared with patients and you're not sure? Those kinds of questions, because we want to be able to use the information to help answer the question of what has the experience with the virus been, how many patients or employees are positive for the result, but also what were those employees, what was their work situation and what was their personal situation in terms of potential exposure to the virus. So we ask those two questions and then we send them to the lab. They get their blood drawn, and then the results come back, and then we de-identify it. We don't want to know who these results are for. We just want to link it up with the answers to the questions. And so far, we've had more than 3,000 of our 7,200 employees say yes, they do the questions, and then we're expecting that they will also go to the lab. And the number keeps growing every day. We started this last Friday, and so we expect that there's a lot of interest. A lot of people are going to get tested.
If there are high levels of these antibodies in this population, and then we can perhaps extrapolate to the larger population of Hawaii, what is that going to tell us? What do we hope to actually learn from whether there are high levels or low levels of these antibodies in the population of your workforce?
Yeah. My anticipation was that because of our low level of disease in Hawaii, we're going to see low levels of antibody. And so far in the first 1,000 or so results, that's been true. So we're seeing very low levels of protection among our workforce so far. We don't have anything to announce yet because it's very preliminary at this point. What that means is that our testing for the virus, which told us that we didn't have a lot of disease in Hawaii compared to other places, is probably accurate. And there have been those who've wondered or worried that perhaps there are hidden pockets of disease that we just haven't found, that in fact the disease is running rampant in parts of our community and we just haven't tested them. We haven't done the right thing. My guess has been that was never true, and our blood test results are going to confirm whether that was true or not. I think what we'll find is if we have very low levels of antibody in our community, it's going to mean that we need to be sure that as we start to open up to visitors, that we are very good at making sure that we test or trace or identify, quarantine, all of those things that others are talking about all the time, going to be really important.
Do you feel that this testing could be beneficial and could be something that could be used to test visitors that are coming into Hawaii to sort of gauge if they are sort of cleared to get in here? Do you think that's a good tool to have as a resource for reopening the state?
Yeah, that's been suggested. There are many places where they're talking about something called an immunity passport, for example, where if you've got a blood test that says your body has had experience with this virus, that somehow you're safer. We don't know that that's true. It goes back to that same question that we talked about earlier. Does having a positive result on the antibody test say that you're somehow immune? We don't know. And so having this idea that we would test and then give somebody a gold star, you're safe, and you're not safe kind of an answer, that's probably not going to be helpful to us. I think the suggestions that we need to test for virus are going to continue to be important right now.
We want to bring the viewers in to ask some questions as well.
Sure.
There was a question here. Sorry, just reading as we go. Cheryl Tsutsumi says, I read a story that says the virus is mutating. Is that true? What do we know about this disease?
All viruses mutate. The question is whether it's mutating in a way that's going to be a problem. And everything that I've read to date says that, yes, they have been noticing some mutations, but that it hasn't actually changed the severity of the illness potential. One of the recent studies says that it's changing the infectivity so that the virus is easier to catch, but it hasn't apparently changed actually the disease itself. The other issue around mutation is that if we create vaccines very quickly, the question is, are those vaccines going to still be useful if the virus is mutated? If it mutates significantly, that could be a problem. That's why we have different flu vaccines every year. At this point, though, I haven't seen anybody saying that that's an issue either.
So could this be something like the flu, where in different seasons we see different types of strains of this disease, and this, it kind of mutates around, and sort of thinking long term. And I know it's difficult because we're learning a lot of information. But when you think of it like the flu, and every year people are getting a flu shot, could this be an additional shot that people might have to get as well as we sort of move down into the future?
Yeah, I've seen less about worrying about the virus mutating and therefore needing different vaccine, but more about we're not sure how long, if immunity works, we're not sure how long it lasts. And so it's possible, and this is completely theoretical, it's possible that every year when we get a flu shot, we'll also get a booster for coronavirus as well, or something like that. But we just don't know.
Mm-hmm.
Jackie Tran wants to know if you could explain why the CDC now recommends wearing a mask while outdoors. I guess there has been some fluctuation in the recommendation, but now it appears that the federal government also says that we should all be wearing masks. And Jackie wants to know specifically about being outdoors.
Right. In general, being outdoors is safer in terms of viral spread. There may be a breeze that helps to move it along quickly or get it to the ground more quickly or that sort of thing. I suspect that the reason that the CDC is recommending that is that they're seeing that although people are outdoors, they're not maintaining very good physical distance. And so if you're going to be within 6 feet of someone, or if you're out running in a group, potentially you could limit the spread of virus from yourself to others by wearing a mask.
One of the other questions or things that we're seeing and hearing, especially on the mainland, is experts saying that as the country heads into these summer months, that they expect the numbers to go down, but a second wave could be coming in the fall or the winter months, because that's when diseases, I guess, thrive. For us here in Hawaii, with our climate and it practically being like summer throughout the years, is that maybe a result of why our numbers have been so low? And does weather have anything to do with it, as experts are talking about this fluctuation based on seasons?
There are people who are certainly looking at that. I think it is known that warmer, more humid climates like Hawaii, the virus particles, the droplets, drop more quickly, and potentially that has something to do with it. I don't think anybody knows. We do see less seasonality of some viral infections, particularly respiratory infections in Hawaii, than other places, but we still see seasonality here as well.
I know that Hawaii Pacific Health has made that antibody testing available to its employees. Do you expect this to now be available eventually to the wider public? I think there are a lot of folks who would love to know if they've been exposed as well.
Right. No, absolutely true. One of the things that we were interested in was, as I said, we want to know some of the risks associated with the positive result versus the negative result. Have you been a traveler? Are you exposed because you deal with lots of customers at work? That kind of thing. And so we actually have already had a number of businesses reach out to us to sign on to the same program. And so rather than having individual people go to their individual physicians and say, I'd like to get this test done, we think it makes sense to do it in populations and get that list of questions answered so that we can match up the result on the blood test to the answers to those questions. We think we'll learn a lot more that way, because if many of the people who have positive results were on a cruise ship or something, that doesn't mean much for Hawaii, but we wouldn't know that if individual people go to their individual physician and get a blood test. All we would know is the result. And so we actually are partnering with some other businesses in town, and I think that will be helpful.
That's very interesting. So the idea being that, of course, you're in the medical industry. Presumably, most of the people who are being tested in this first group are in the medical industry, and then you widen it out to, let's say, essential workers in a grocery setting or in some other kind of setting. Who would be the ideal? Where would you think would be great to test next, since this is sort of a limited program?
Right. I think what we're interested in is looking for those areas where it was most likely that people would have been in contact with this virus and would have antibody. So if you think about it, healthcare workers make sense, right? Because we are taking care of those patients. But perhaps, as you say, essential workers, folks who worked in the tourist industry before it shut down, because we know that a lot of our infections were introduced by visitors. So potentially folks in that setting. And we're just finding that there are employers who want to do this for their employees because their employees are concerned.
Are there enough tests? When do you think something like that could actually start to be implemented in our population?
Right. Right now, our lab tells us they can do about 1,000 tests a day. They're expecting in another week or two to be able to ramp that up significantly. And I should say, though, that the Department of Health and the public health community would rather do a true population study where you would decide how to do a representative sample of everybody in our community, and you would go and you would ask certain people to be tested. That's the right scientific way to do it. We recognize that this is not scientific that we're doing, but it takes a lot more time to put together a study that you could then do all the statistical analysis and actually come up with something very valid. We think that ours is what's called pragmatic or a convenient sample, and all we're doing is getting an indication of what is the level of antibody among this group of people that we will have a few questions answered for.
I want to bring in another question here to sort of wrap up, but we do know that there's different countries that are taking different approaches to this, and Tobias is asking about the Sweden model, or the theory that tried to get as many people exposed to build up the antibodies so that it doesn't affect them later. What are your thoughts about the overall exposure to try to help build up sort of an immunity to this?
I think everybody knows that we need immunity. Whether we get that immunity from a vaccine that is successful or we get that immunity from natural infection, it's a choice. And so the Swedish model is really interesting. They may be much better at keeping risk groups at home than we potentially would be. And so I think, it's clearly just a choice. Now, it could be that as we go into this next phase, as we begin to, go back to work and back to school and all of those sorts of things, that we still will want to keep older and immunocompromised folks, out of that pattern and keep them safe, which I think is partly what Sweden has been working hard to do.
All right. Well, thank you so much, Dr. Ashton, for taking the time and educating us about it. I think it was very informative. There's, I think, a lot of questions about that. And I know I gained a lot of more information about that. We appreciate you just sort of bringing light to this new testing that's happening and some of the efforts of Hawaii Pacific Health. So thank you very much, Dr. Melinda Ashton from Hawaii Pacific Health. Aloha.
Sure. Bye-bye.
So interesting, Ryan, to hear her thoughts and also to get some clarity, because we hear testing all the time, but what does that actually mean? And she talked about the difference between getting a COVID-19 viral test. And I didn't really realize that there was that sort of sweet spot with the test, that if you test too early, you don't have enough virus in your mucous membranes to actually detect virus. If you test too late, the virus has already moved on to another part of the body. So you've got to get it right at the right time. And there are a lot of folks, I'm sure, out there who think, well, I was sick back in February, or I was sick in early March, or my spouse was sick, have I been exposed? Or like she said, people who are in the visitor industry all over. So this antibody testing really sounds like it will be the next step. And we'll be very interested when Hawaii Pacific Health shares their results. She said they've done about 1,000 so far, 3,000 employees filling out that initial questionnaire out of the 7,000. And so she expects there to be quite a bit more tests performed over the next week or so. And then hopefully they'll be sharing that soon. And as soon as that's available, we'll be diving deep into those numbers, because it could be very revealing about what is happening with the coronavirus here in the islands.
Yeah, and I thought it also interesting to note about, and we're going to talk to Lieutenant Governor Josh Green tomorrow. One of the things that he has been an advocate for has been this type of testing to have visitors take upon arrival here in the islands to sort of gauge if they are able to enter the state as a guest and visitor. So it'd be, just in hearing what she's saying and how there are still a lot to be learned about this testing alone, that it may not be the most secure way to say, yes, I have the antibodies, but that doesn't necessarily mean that you're immune from carrying it again. So I think we're in this phase of still learning, and interesting to see how state and local officials are going to have to find ways to use this testing period to implement it into the policies that we're sort of moving forward with.
Yeah, very interesting. The idea of an immunity passport. So many people have sort of lobbed onto that, but you hear her talk and it sounds like, wait, not so fast. Perhaps we need to do more, and that includes testing for the virus itself. Health experts and policy experts, there's an interesting article today, moving along to some other headlines, saying that it's too soon to reopen our state. And, we have the public health issue and we have the economic issue when it comes to this virus, and there are competing interests there. So we invite you to head over to the Star-Advertiser.com, check out that article. Very interesting to see what health experts are saying about reopening Hawaii businesses, and then Hawaii businesses saying about, the health of their wallet. So that we encourage you to read that piece. It's a very interesting article.
Yeah, and it goes kind of into also the contact tracing, and that the state needs to do more of that. So I think that and we're seeing it really throughout the country and throughout the world, is this differences in opinion about when to open, and some saying that we are just sort of in the height right now, but yet we're seeing many cities across the country begin to reopen business. So interesting article there to see how that impacts. And again, time will tell. I mean, we're now going to be a few weeks in where we slowly start to see things reopen. I think even more attention is going to have to be made to those numbers and to those counts to ensure that we continue to stay at that low number to help protect our hospitals from overcrowding.
Another issue in the paper, and something that we're going to be talking to Lieutenant Governor Josh Green about tomorrow to get his thoughts on, is the state attorney general and prosecutors want to stop the release of inmates from Hawaii prisons because, there have been a lot of concerns that if COVID-19 were to infect the prison population, given the overcrowding that we see in our jails here, what that could mean health-wise. So a lot of those folks have been released, and that continues to be a program that's in place. Now, some public safety officials say that should be put to a stop. So interested to hear what your thoughts are on that. Write us, let us know if you think that this program should continue, or given the fact that the virus has not shown up in prisons, if you think it should be halted.
Yeah, the state attorney general, Claire Connors, actually saying that they may have to actually go to the Supreme Court and request a pause or to stop the granting of these releases because they just feel that it could be an impact and a danger to the community. And again, we're going to be talking more to Lieutenant Governor Josh Green tomorrow. So we hope to get his thoughts on this as well as some other issues that are, of course, happening, the reopening questions that are happening, as well as more of these antibody testing. So if you have a question, again, for Lieutenant Governor Josh Green, make sure you tune in same time here tomorrow and actually input your questions here today so that we can sort of queue those up for the Lieutenant Governor when he comes on tomorrow.
We always like to talk about a Hawaii hero. Today, we are talking, of course, about a major food distribution drive, and we want to show you a graphic there. That's why we're going to squeeze to the side and try to fit that in. There you go. Food for Hawaii's Ohana. This is such an important program. This is brought to you by the Hawaii Food Bank, Hawaii Community Foundation, Bank of Hawaii, and the City and County of Honolulu. They did a drive like this last week, and we saw thousands of people lined up in Waipio. This is happening today at Aloha Stadium. They're giving away quite a bit of food, I believe about 50 pounds, and they are encouraging multifamily pickups. So that means you have a few heads of household in your car. You have to prove that you're gathering for more than one family if you do, in fact, want to do that. You'll be asked to fill out a form and then go through the line, and they are asking you to make sure that your trunk is cleared so that they can just load it up and get you out of there. They want as little contact as possible. That's a map there. We encourage you, if you are in need, to head over there. If you can't make it to today's drive, don't worry. There's going to be another one at Leeward Community College. That's going to be on Friday. All the details for both drives is at hawaiifoodbank.org. It's really sobering to see the thousands of people who are lining up to get this food. It just shows you the need in our community. We really want to salute these companies and these community groups for putting this on and to get people the resources that they need during this very difficult time. So again, you can head over there today, or you can wait for Friday's distribution. And there are going to continue to be distributions. This is obviously not the last week of this, but today and then Friday, Leeward Community College.
That's right. So we want to highlight our heroes again, the Hawaii Food Bank doing so much right now for the community, as well as their partners in this, in Bank of Hawaii, Hawaii Community Foundation, and the City and County of Honolulu, all coming together to sort of provide this effort. So mahalo to all of them for helping to support those who need them, who are in desperate need right now.
One thing that you can do, we talked a lot about testing today. One thing that you can do is the contact tracing. So make sure that you fill that out. That's Aloha Trace is where you can fill out your daily tracing information. They really want to see how the virus is spreading in the community. Takes 2 minutes, just head over to Aloha Trace. The other thing that you can do to help our state and help our community is fill out your census, 2020census.gov. Quick and easy, confidential, takes about 10 minutes. Please do fill that out because federal dollars are tied to every single person that is counted. So we want to make sure that Hawaii gets its fair share and is counted.
And that's right. Again, looking forward till tomorrow with Lieutenant Governor Josh Green. And then on Friday, we'll be hearing from University of Hawaii President David Lassiter to talk more about their big announcement, which happened earlier this week, saying that the University of Hawaii system will resume in-person classes beginning in the fall. So want to hear about some of the changes and challenges that presents, as well as some of the things that they're going to be doing. And then next week, again, we have another full lineup, including the governor, as well as with, we know a person who's very popular on this show is Scott Murakami, the Director of Labor and Industrial Relations, to talk more about the unemployment numbers. So another full week ahead next week, but looking forward to having Lieutenant Governor Josh Green on the show tomorrow.
Okay, and until then, we wish you a fond aloha. Take care of yourself. Wear your mask if you head outside. Remember, it's not a full green light yet. It's safer at home. So do continue to stay safe, protect each other, and be kind.
Aloha.